Hello, Sinead here from the Birth Partner Project. I'm just going to walk you through our birth preferences presentation so that when you share this with a woman you're supporting, you really understand the value of this work. Birth preferences are simply a record of what you'd like to happen during your labor and your birth. They're not essential, but we often find as birth partners that it can be really helpful to get an understanding of what makes a woman feel most empowered and most informed in preparation for giving birth. It's also really quite reassuring for her to know that everyone on her team, from her partner to her midwives and doctors, understand what makes her feel most comfortable and what makes her feel most respected. The first thing to think about is the environment. So, the way to do this is to go through all the five senses and get an understanding of what this person feels most comfortable and empowered with. So, touch, if they've given birth before, they might already know, like, I really like very light stroking kind of massage on my back, or maybe they want quite firm pressure, or just hold my hand, or maybe don't touch me at all. Everybody get off me. I don't even want to wear any clothing on my skin. Everybody is different, and it's really important when it comes to physical contact that we're always getting consent, we're always reaffirming that consent, and always putting that power back into onto the woman. Um, we'll also talk about kind of checks in a moment as well underneath physical touch. We'll go into that a little bit more detailed. Smell. As a birth partner, you might have explored aromatherapy with the woman that you're supporting, or maybe there are some smells that she already really likes or feels comforted by, maybe something from home that she could bring in with her. Like this, if she already has other children, maybe their blanket or something of her partner's. If she's married or in a relationship, this could be really different for everybody. I do recommend looking into oils that can make us feel more relaxed and comfortable, and exploring those way, way in advance before going into labor, because you don't want to be pulling lots of different things out in your bag and getting distracted. We want to be really prepared with this kind of toolkit before we go in. Similarly, there are smells that might make a pregnant person feel completely sick, and we don't want those around either, um, or anything that's going to cause a distraction. Sight. Um, if you go through some birth affirmations with the woman that you're supporting, it might be nice to create some bunting and hang those affirmations in view, reminding her of her power and how incredible it is that she's giving birth and that she'll be meeting her baby soon. And there's lots of birth affirmations that you can find online, or you can talk to us for some inspiration. And of course, talking to the woman you're supporting, what makes you feel strong, what makes you feel supported and empowered. Um, on the other end of sight is, are people coming in and out of the birth room going to be really, really distracting? An example we often hear as doulas is that you wouldn't expect someone to be able to go to the toilet with lots of people in the room. Similarly, in birth, we need hormones that are allowing our bodies to open and relax. And so, any kind of stressor that is going to stop those hormones from being produced is really going to delay their experience of labor and birth. So we don't want anything that is causing stress and distraction. On the other hand, some women might feel very reassured to always see midwives and doctors around, and to know that there are plenty of people nearby. So yeah, really getting an understanding of what makes them feel most safe. Um, taste. Eating and drinking during labor, there are lots of conflicting information around this, but we should always stay hydrated. And you wouldn't expect someone to run a marathon without having eaten. So, having snacks on hand is really important for energy levels. Um, and also understanding this person's culture. Maybe there are things that they eat during labor or right after that will make them just feel really comforted and might be important to them religiously as well. So, getting to know that beforehand and being prepared as much as you can. And you can always ask us if there's something that you need to maybe purchase or look for, and we will always try to accommodate. And lastly is sound. So we have some hypnobirthing tracks that you can share beforehand that can help to mentally prepare women for labor. There might be words that you go over together that you can um, say to her while she's in labor. Phrases that you can practice together. Um, Yeah, maybe there is music that helps her feel relaxed. Some people feel really relaxed by really calming music. Other people might feel like this is just really unnatural and triggering, and maybe they want like their playlist, Spotify playlist on in the background, or they want hymns or religious songs or to hear prayers. Maybe they'll want to be FaceTiming family or friends and just have those voices near them. It really, really, all of this is so individual and personal. So it's um, really recommended that you go through the senses when you start talking about preferences. And really, really importantly, before any of this, you should already be quite used to working with an interpreter if the woman you're supporting doesn't speak quite a high level of English, even if it seems like conversationally their English is pretty good. It's really nice now and again to use an interpreter and just make sure that you're really on the same page and things are very, very clear. Um, Sometimes there can be miscommunications with interpreters, and especially if you're talking about birth and anatomy and very intimate parts of the body and things like this, interpreters might, for cultural reasons, um, not use the kind of exact phrasing that we would use. And so it's really important that you ask open ended questions rather than questions that are just going to give you a yes or no. So you can really understand the comprehension of what you were trying to understand, and that you're just really on the same page. So getting really used to using an interpreter if you need to beforehand, and making sure that there is an interpreter around in the birth room. You just have to ask the midwives for this when you go in, and they should provide a machine for that. Monitoring and checks. Um, vaginal examinations are quite standard in hospitals, um, and so is intermittent monitoring of the baby externally with a stethoscope. Prior to labor, it's really important that you explain to women, or rather that their midwife explains to women, that this will be offered, that they have a choice of this happening, and that they should always be kind of asked repeatedly throughout. Can I touch you? Can I have a look? That's a phrase that is often used, and we just want to make sure that people are really clear that what that means. I've heard midwives use the phrase like down there rather than saying vagina, and it's not helpful when we don't use anatomically correct language, it can cause confusion, and we don't want anyone being in labor or birth suddenly feeling um, like they've that they've had their autonomy taken away from them, or that they weren't expecting something like that. It's really important that that communication is very, very clear consistently. It's also important as birth partners for us to understand what can inhibit physiological birth. There is a lot of information around this. It's not up for us to give medical advice, but we should always encourage mums to um, understand why these checks are in existence, and why they're done and who they're benefiting. And again, always just gently reminding the mums that we're supporting that they have a choice, and consent is always really important. For women who are higher risk or having complications in labour, monitoring and checks might become more continuous, and they might be offered, or rather recommended, fetal monitoring, which happens vaginally. And again, it's really important that women understand what's happening, because these kind of checks mean that they might not be able to walk around and move in a way that is helping them self-soothe, and can help to progress labor. So understanding the benefits, but also the risks. Um, and that's for your knowledge, but it's really important that the midwives are communicating all of the benefits and risks as they're going along. So don't worry. It's not on you to necessarily have to share that information, but it's great for you to be there to kind of gently prompt if communication is maybe breaking down around an understanding of this sort of thing. Relief in labour. In a hospital setting, there are a variety of options for pain relief. Maybe prompt the women that you're supporting when they have meetings with their midwives leading up to their birth to explore those options. What are the benefits? How would they be administered? And what are the risks? For not complicated or unhigh risk births, self-soothing in labor can look like visualization, breathing, affirmation, prayer. Warm water is said to be very relieving for a lot of women. Some people give birth in water, others will have kind of flannels and heat pads and various things depending on their setting. TENS machine is something that can be bought fairly cheaply, and I recommend looking into that so you understand what it is. If you have certification in things like acupuncture, massage, reflexology, and aromatherapy, that is something that you might want to offer as a birth partner, and always being very clear of the benefits, the limitations, and the risks with the mother, and getting consent far before labour starts. We don't want someone to be in labour and to feel like they're suddenly presented with loads of different options, and just being distracted and overwhelmed. The second stage, or the pushing stage, is as individual as anything else. Some women might want to be really coached and cheered on, and for you to kind of just be constantly kind of cheering them on from the sidelines, and their midwives cheering them on. They might want everyone to really be quiet, and just leave them alone. They might want to breathe their baby out, and for it to be as gentle and as slow as possible. They might be really want to push, and this can obviously change in the moment as well. So listening to how she's responding, and what she needs, and asking what she needs beforehand. positions as a birth partner. It could be really bonding for you to maybe explore different positions before labor, and understanding what optimal positions are for birth. This is definitely something that women should chat about with their midwife as well. Um, at this point, pain relief is probably already established, if there is any, if it's self soothing and natural, or if it's um, a form of medication. And still, hydration, having like a big bottle of water nearby, or um, maybe with a straw, so it's just easier. That's going to really help as well. Um, I've put plan B here, so just knowing like if things aren't progressing in the way that we would, the birthing person would like, what is the alternative if they are, really hoping not to have any kind of pain relief from the midwife or doctor, but things are just getting overbearing and now they're asking for it. What does that look like for them? Um, what is that option? And then also talking about skin to skin. This is something midwives can help discuss as well beforehand, what the benefits are of immediate skin to skin with their new baby. Here are some birthing position options, um, and we know that when a woman is able to move around and kind of sway and just go with the natural rhythms of her body, she's going to feel a lot more comfortable leaning forward and kind of being on the side of gravity rather than laying on her back is often said to be like the optimal kind of birthing position. Um, yeah, being upright and just natural movement. This is going to be different for everyone. Some people might be crawling. Some people might want to squat. Some people might want to lean on you or lean on an object. And similarly, I haven't put it in this presentation, but natural sounds. Um, if women have watched a lot of movies where people are giving birth and the woman is just screaming this high pitched scream, they might think that's really normal. They might think that they actually have to be quiet in birth. Generally, women tend to have all sorts of sounds come out of them, sounds they might not even recognize coming from themselves. And this could be really normal, and they should go with what is feeling natural and what is feeling helpful to them. Um, High pitched screaming is likely to make them feel less in control. And so, um, maybe chatting about that beforehand, that they should feel really safe to kind of groan and moan and moo and whatever it is they need to do. And their midwife should also be encouraging that. Next is water in birth. We kind of briefly touched on this earlier, but the benefits are easing discomfort. They can feel more present. It helps to produce endorphins, which helps with pain relief. There is evidence to show that water in birth can help with a shorter labor, and it's also very relaxing. The buoyancy that water creates can be so relieving for a woman who's, you know, very feeling very, very heavy. Um, Her joints might be really aching, so it can just be such a nice way to bring your baby into the world. This should be talked about in advance to the midwife, understanding if there are options to have a water birth at a hospital. And if not, what are the alternatives? Are there showers or baths, heating pads nearby? Things that can be prepared maybe in advance. Labor, ward, and delivery. Just like we touched on with the senses and in the environment, who's present? Would they feel comfortable with students being around? Um, Hearing lots of discussion, would that be distracting, or would that make them feel quite comforted knowing that there are plenty of people who are professionals at hand? Um, Again, always thinking about those senses. Induction and assisted delivery. Midwives should already have kind of discussed these options and how they might be presented during labor to the woman. She might want to make sure that no one brings this up during birth, or she might want to plan for if these things are needed, what are her preferences, and just understanding, of course, the benefits and the risks of any of these things. Um, the golden hour is recommended when babies are skin to skin with their mother to help with a whole variety of things to help get her oxytocin flowing. It's going to help her birth the placenta. It's going to help with her milk coming in. And so understanding that it's not necessarily just like a romantic concept, that this has a physiological purpose. During this third stage, there are always options as well with how the placenta is birthed. If they want to receive synthetic oxytocin to birth the placenta, or they want to wait, is there a ritual that they have with the placenta in their culture? Cord clamping, is that done immediately, or do they understand kind of delaying, and how much delaying would they want? What are the risks? What are the benefits for the baby here? And in the event of hemorrhaging, what is this person's preference? There may be religious reasons why blood transfusion isn't recommended or wanted. So, yeah, still, even after she's birthed, there are many preferences to go through here. Cesarean section, this might be elective beforehand for a variety of reasons. This might just be something that the woman wants, or there might be a medical reason. Understanding what a C-section is, and how this would happen, who would be in the room, understanding there would be a whole team of people present, and what their roles are, and how this may or may not interfere with the first contact with the baby, and who, as a birth partner, you might, for example, be expected to hold the baby or help hold the baby on the mother's chest, and just, yeah, understanding what that looks like, and making sure that women know that even with a C-section, they can really still have so many preferences and choices to kind of have that birth that they want with a C-section. Anything else? So those first few moments that baby is earthside can go by very, very quickly, and as a birth partner, you can help to make them special for the mom. When it comes to dressing and bathing the baby, they understand what the benefits are, if any, of doing this. Are there any cultural preferences for them? Who should do it? That the baby is likely to be administered a vitamin K shot, and they will be asked once they give birth, just reminding them, is this okay? Is this what you want? It's an injection, I believe, usually in the leg, um, and your mum's midwife can go through the benefits, and why that is offered here. And breastfeeding, it's going to be such an individual journey for each woman, letting them know that they're supported and that their midwife will help them with those first few feeds, knowing any foods that might help, and understanding about latching, and what they can do to kind of really optimize their breastfeeding journey in those first early days. So that is it. If you have any questions, get in touch with me, get in touch with Emily, ask other birth partner volunteers. There are so many women on our team who've been doing this for years, who have birthed many times, um, and also build relationships with the women you're supporting's midwives, whenever possible, if possible, um, and just making sure that this person feels like they have this whole team around them that is there to cheer them on and you know, do whatever they need to make them feel comfortable and safe and respected while they're giving birth.